Welcome back. Now, with 7,097 fresh cases, taking the overall tally to 1,31,868, India now has the 10th highest number of confirmed cases worldwide. With 6,977 new cases, the death toll has crossed the 4,000 mark. The number of active cases stood at over 73,000, while 54,000 people have recovered. Maharashtra, which accounts for a third of all India cases, reported a surge of 3,041 cases, its highest till date, to breach the 50,000 mark. The number of cases in Gujarat crossed 14,000 with 394 new infections. In the last 6 days, at least 500 cases were registered daily in Delhi. Now, while the health ministry has maintained that the low positivity rate does not warrant more intensive testing, records show that a steady rise in positivity rates over the last 4 weeks. This upward trend in positive cases is significant and a cause of concern in the wake of increased movement of people from red zones into green and orange zones. Well, we have Sneha Murdani with us, who tracks the health ministry. Sneha, a lot of concern being raised about the fact that things are opening up. There is easing of restrictions. Domestic flight services are resuming today. At the same time, cases constantly increasing.
Yes, Vandana, I just want to quickly just first touch upon that point that you made about the number of cases testing positive. If you just compare it with the number of tests being done, the health ministry does this calculation over a period of 14 days. The last time I checked was around 3 or 4 days ago, because that's when the government actually met with the press, was that they continue to maintain that our positivity rate is at around 4.5%. This fluctuates, this varies, but I believe, and this is obviously through sources within the Indian Council of Medical Research also, that this is increasing, which means that the more we are testing, the more positive cases we are finding. This is actually above the 5% mark right now, and this is going to increase only further. It's natural. It didn't see a leap in the sense that from the time we were not testing much till today, our positivity rate was at around 3.5%. If it's touched the 5% mark, and that is something that the government would want to comment on, at least formally on the record, then it's not a massive leap, but it is an increase nevertheless, which means more testing needs to be done in the country. The government has said that 1,50,000 samples is what we can test on a daily basis across a network of close to 600 labs in the country. This includes government as well as private. But yesterday we tested 90,000 samples. In 6 days in a row, we've actually tested 1 lakh samples and more. That brings us to over the 30 lakh figure. So we've tested more than 30 lakh samples in the country already. Remember, these are samples and not people. The figure of people being tested is actually much lower. In fact, if you have to compare with other countries, it's also important to compare that India is not testing much. It isn't. It may have a good the death rate obviously of the country is low. It's stable at around 3%. It fluctuates up and down a couple of points here and there. That is stable and good if you compare to other countries, but our testing rates aren't. So let's be clear about that. The government, of course, has said that we have 7.1 a person every 1 lakh population in terms of cases, but like I said, more testing, more cases. So if we test more, there will be more cases. Having said that, we've crossed the 1,38,000 mark already. Our recovery rate has almost touched 42%. That is something to be reassured about. More than 3,280 people have recovered in the last 24 hours, and the government hopes to improve this even further. The focus is clear: reduce the number of deaths, critical intervention in areas which require the same. Patients above the age of 60, senior citizens, those people with underlying healthcare conditions need to be extra careful even as the lockdown continues to ease out. And hopefully we'll be seeing more easing out of the lockdown post the 31st of May, since the economy also needs to open up and get back on track. The government has said, at least on one occasion, that this is something that we have to live with. This is a virus we have to live with, and we have to work our way around it. So I think the sense really is that we can't sacrifice livelihoods right now, and that's the reason why we need to open up. However, states of concern, Maharashtra, cities of concern, at least 3 in Maharashtra, Mumbai, Pune, Thane, these are the places reporting at least maximum number of cases with the highest viral load in the country. And you will see specific interventions in these areas. We've seen it over time and again. Just a day ago, the municipal commissioners of at least 11 places were also in fact held a meeting with the health secretary, discussing how much more needs to be done to contain in the problem areas of the country.
Right. Stay on with us, Sneha. One problem area undoubtedly is Mumbai, where Radhika Ramaswamy joins us from. Radhika, like Sneha was saying, we're possibly going to see more easing of restrictions post the 31st of May, but there are already voices of dissent coming in. Uddhav Thackeray has already gone on to say that the sudden imposition of the lockdown was wrong, and if the government lifts it in one go, it will be wrong as well.
You know, as far as Mumbai, Maharashtra is concerned, yes, the numbers are on a rise. We are talking about 3,000 cases just recorded yesterday, which is the highest single-day spike. So that takes the total numbers to 50,000 in Maharashtra, and 1,700 is the number that we are talking about Mumbai. So that makes it 30,000 in Mumbai. The numbers are on a rise, so are the death rates. Now, as far as restrictions, easing of restrictions are concerned, we saw that, you know, as far as the city of Mumbai is concerned, there is not much restriction that, that we are seeing. Apart from a few non-essential stores, home delivery of liquor, and also some offices that are open, which are government offices with just 5% capacity. Nothing else is functional really. No cabs, no taxis. But, you know, this is one of the reasons why the state government was not fully agreed to the functioning of airline. Of course, 25 you know, flights are running, departing and arriving, because you know, if the flights are fully operational, then that will lead to you know, more operations, more logistics, more taxis and cabs on the ground. That needs to be worked out as well. Right now there is no you know, relaxation in terms of cab services, taxi, buses. Only for essential services these are provided. So not much relaxations really, at least till 31st. After 31st, Uddhav Thackeray, Chief Minister, did say that there will be some amount of graded relaxation in terms of shops and industries. But it remains to be seen how much of relaxation can the city of Mumbai really afford, because right now the cases are on an ever increasing rise. It had been 1,000 on an average, then it became 1,500. Now it's almost touching 2,000 average just in the city of Mumbai alone. So therefore this is something that the state government is really finding it difficult to you know, deal with. Of course the focus right now is on increasing the number of hospitals, hospital beds, more quarantine centers, something that Chief Minister also spoke about in that address yesterday, that there is a lot of effort being done to ensure that medical infrastructure is enhanced. So that is also the focus. So more than relaxations, right now the focus is to ensure that there is more health infrastructure that is being put in place, because the numbers are on a rise, and we are talking of average of 2,000 as far as Mumbai is concerned, and 3,000 is what the state is touching on an average.
Worrying numbers indeed, Radhika, but thank you for joining us with the latest. Thank you, Sneha, as well, for joining us earlier. On that note, we'll slip into a quick break. More news on the other side. Stay tuned.